Downing. I'm a student nurse at MCC, and I'm going to be showing you how to give an intradermal injection. So to begin, we're going to head over here to the MAR, because we just received a physician's order for an injection. It is for Manitox, 0.5 milliliters intradermal today. Report results to MD in 48 hours if we have any, and if that, I'm going to be circling the injection site around it, and then if we have a reaction or if it spreads beyond that site, then we would report what we find to the provider. So I'd come over here to the MAR, make sure everything is in line. Manitox 0.5 milliliters intradermal today, and everything matches. We have the right patient, drug, dose, route, time, and documentation. So we are good to begin and head on over to the bedroom. Alright, so I already got my equipment prepared. We got this right here. And we will prepare by opening up our syringe. But before I do that, I'm going to wash my hands. We're getting there. Right. Now that we have done that, we're going to clean the top. Good. Dispose of my garbage, pull out, and this is when I'm going to perform my second check by confirming that we have the right med for the right patient, that we have the right dose at the right time with the right route and with the right documentation once we're done. And that we do, so we're going to drop 0.5 mils. So we pull back and get the right amount of air in there. 0.5, wonderful. We just cleaned up the top, so take off the safety. And administer right here. Flip it. Pull out my 0.5. Flip the syringe a bit to get out all the bubbles. That we did. And this is when I do the scoop technique. Alright, and we'll set that aside, put away my materials that I got out, and to identify where to give the intradermal injection, I'll just show you on my arm right here. So we're going to be giving it on his left forearm, and it'd just be anywhere within this range, away from some veins, to avoid any punctures that we shouldn't be touching, and we'd probably give it around right there. Just away from any sensitive areas or veins or things like that. So now that we've identified our correct spot, we are good to head to the patient's room and begin the procedure. Alright, wash my hands before I enter.
Hello.
Hello, my name is Nurse Downing. I am here to give you the intradermal injection. Are you familiar with this kind of procedure before? Alright, wonderful. Before I get started, can I get your full name and date of birth?
Frank F. Furter, 3/14/1950.
Perfect. Now, I have already identified how to find the spot, so we're good there. Do you have any allergies?
I don't.
Alright, good news. Now, we are good to proceed with the procedure. I have located my site. Now I'm going to prep it with this alcohol pad. Now, again, I'm just going to do my third check that we already meet the rights, that we have the right drug, route, dose, time, drug, and documentation. And now that we've prepped the site, identified that we still have the correct dosages, the right patient, and all the other rights, we are good to continue with the administration. We have located the site, we've prepped it, identified our patient. Thank you, nurse. And now we are going to administer the injection, and you're going to go at a 5 to 15 degree angle. Alright, and just far enough into where the bevel is up and in, and you create that wheel. So a little administration right there. But I would also spread the skin too. It's not the prettiest wheel. Well, it's not the prettiest wheel. Usually all of that would be in there, and there would be just a tiny little wheel above, but for the sake of this, that is okay. And then now do the one-hand scoop technique, and discard of this in my sharps container. Now that that is done, I'm going to take off my gloves and wash my hands. And this is when I would draw the circle around the wheel with the marker. And we would reassess in about 48 hours, and if anything has passed that mark, then we would report that to the provider. Is there anything else I can do for you, Mr. Frankfurter, today?
No.
Alright, wonderful. Just wash my hands one more time. I'll have it, give you your call light and leave you be. So now we head back over to the MAR, and this is when we would document that we gave this Manitox solution 0.5 milliliters intradermally to his to his left forearm. And we would document today, the 2nd of February 12th, 2020, by D. Downing, student nurse at 1700. Make sure it's all good, it's charted, and that is how you give the procedure.